Welcome to PopHealth Week, streaming live on Healthcare Now Radio. I'm Craig Masters, co-founder and executive producer. Joining me in the virtual studio is partner and co-founder Fred Goldstein, lead host and president at Accountable Health LLC. PopHealth Week is your destination for unfiltered conversations with the visionaries driving population health forward. Whether you're a payer, provider, patient vendor, or policymaker, this is your go-to hub for fresh strategies and insights into population health best practices. Want to stay connected? Visit popupstudio.productions or message me on Twitter via @GregMastersMPH, and that's Greg with 2 G's. And do follow the show at PopHealthWeek. To reach Fred direct, visit www.accountablehealthllc.com. With no further delay, Fred, who's in the seat today?
Thanks so much, Greg. On this episode, I'm going to do something a little bit different. I'm going to weave together some of the work I do in population health and discuss the intersection of marine biology, local ecology, and human population health. As some of you may be aware, I originally planned to study sharks. I was going to go into shark research from the 4th grade on. It was just a passion of mine. I got all the books, the Jacques Cousteau books, watched all the TV series, and just said, this is what I want to do for a career. I ended up going to college and getting a degree in zoology with a focus on marine biology, and actually was fortunate enough during that time to go to Mote Marine Lab over in Longboat Key, Florida. At that time, Mote Marine Lab was the only place doing shark research in the United States that I was aware of, and they let me come in as an intern. It was a great summer. I got to live on a boat. At nights, I'd be the only one there. I had fishing and all kinds of stuff, and we did shark research, sediment analysis. We did seine netting along the shoreline, doing species counts. It was a fascinating summer, and at the end of the summer, I spoke with the head of the lab, who explained to me that given the fact that sharks really don't attack people that often, the Navy had discontinued funding for research, and at that time there was not a lot going on in the research area, so that perhaps I should find something else. Combine that with the fact that I thoroughly enjoyed my time at college, probably a bit too excessive. I didn't have the greatest of grades at that time, so I took a year off, decided to go do something else, talked to my father, who was a professor of medicine, and ended up in healthcare. I never wanted to be a clinician, but I very much enjoyed my time in healthcare since then, and obviously getting into population health now. When you think about this, and how I then combine that with where I am today, about 4 years ago, but it really happened about 20 years ago, my wife and I were living in Jacksonville, Florida, and said, if we could live anywhere, where would we want to live? And it turned out we'd been coming down to this place called Merritt Island, and essentially it's by Titusville and Cocoa Beach and Cocoa. It's about 40 miles east of Orlando, and we would come down here for a couple of reasons. One was Kennedy Space Center. The north end of Merritt Island is home to Kennedy Space Center, and we would bring the boys here and do the Kennedy Space Center Visitor Center tours and look at all the rockets and come down for launches. And also, because we love to be on the water, and whether that's kayaking or fishing, I started fishing down here in the mid-90s. And so we decided if we could live anywhere, we'd come down to this area called the Indian River Lagoon, and in particular, we got lucky and we moved on to Merritt Island. So we're about 40 miles east of Orlando, and the island itself is between Cape Canaveral and Cocoa Beach to the east and Cocoa to the west. It's right in the middle of the Indian River Lagoon between what are called the Banana River and the Indian River. Now, interestingly, the Indian River Lagoon is actually 156 miles long. It begins at the Ponce de Leon Inlet up in Volusia County and ends down at the Jupiter Inlet in northern Palm Beach County. It comprises or goes through essentially 5 counties, but 70% of it is in Brevard County where I live. And while it's called the Indian River Lagoon, it is not a river. It is an estuary composed of the Mosquito Lagoon, Banana River, and the Indian River, but none of them are actually rivers. In fact, there is no natural flow in here like a river would have, but there is wind-driven flow to the north and to the south. It's very shallow throughout it, and it's also fascinating in that there are over 4,000 species of plants and animals that live in this extremely diverse estuary. Over the years, with all the growth in this county and the other counties and all the growth along this lagoon, it's created a huge ecological shift. And so decades of this nutrient pollution has been flowing into the Indian River Lagoon and essentially creating severe harmful algal blooms. In 2011, there was a super bloom, a massive green-blue algae bloom that covered huge portions of the north and central lagoon and lasted about 7 months. This bloom destroyed about 60% of the Indian River Lagoon's seagrass beds. Then, in 2012 and 2013, there were massive brown tides, which killed off further seagrass as well as caused fish kills. And in 2016, there was a massive fish kill. This was one of the largest in history, and hundreds of thousands of dead fish blanketed the shorelines. The following years continued to see decline in the Indian River Lagoon. So let's also talk about the lagoon and discuss it from a population health perspective. Many of you may have heard of Shinrin-yoku, or forest bathing, Japanese forest bathing, and being out in nature and all of the positive aspects of being out there in nature. It's just amazing what you can get from being out and sitting in nature and enjoying nature. These effects on health have included things like lower rates of depression, cortisol levels, on and on from being out there in nature. And they also occur in blue spaces, which are areas near the water. And some research has shown that if you're living near blue spaces that are obviously clean, you end up typically living about a year longer. And I can tell you from my own personal perspective, just getting out on the water or looking at the water, enjoying the sunrise or sunsets is really incredible. And as I said, this research has shown reduced cortisol levels, improved mental health, and it also encourages physical activity to be in these areas. Now, the negative about this is when you suddenly have a lagoon become toxic, the dynamics flip. What led to this was too many nutrients coming in particular, septic tanks, street runoffs, and other issues, and these led to deposition of muck. And muck is like this mayonnaise type. It's not sand, it's really finely grained particles, and it's very nutrient rich, and it essentially fluxes or releases nitrogen and phosphorus into the water around it. And over the decades and decades and decades of this area growing, suddenly we have these huge muck deposits. Those, along with the ongoing septic tanks and the water runoff with fertilizer coming in, as well as the fact that more fresh water is flowing into the lagoon, both through canals that were cut from the west to drain wetlands over there to build properties on, as well as just concrete places and rooftops create these huge runoffs of water. And so the efforts now are, how do you solve that? If we look at this issue from the point of view of some of the animals, et cetera, in here, and I talked about the fact that seagrass essentially died out throughout the lagoon, and that was sort of the base of all of this. We're now seeing things like dolphins who are being exposed to these toxins from the cyanobacteria, which are the blue-green algae. And those toxins apparently lead to some neurodegenerative disorders. In fact, studies of stranded dolphins in the Indian River Lagoon have shown their pathology, or their brains, look similar to individuals who have Alzheimer's disease. Just a fascinating discovery, not a very good one to think about. But when you consider that, along with the fact that these toxins from these cyanobacteria can be aerosolized, and we now know through other studies that these toxins are being found in the nasal passages of people who live on or near the lagoon. Now, we haven't connected the two, don't know if it's enough to cause those kinds of issues in individuals or other diseases, but clearly there's a health impact to living next to a poor body of water. And so whether it's respiratory issues or liver toxins from being exposed to these algae when you're swimming or eating the fish, etc., a lot of issues associated with these algae blooms. So when you think about this and you say to yourself, what are we doing about this? It suddenly dawned on me that when I moved down here, I rejuvenated my love for being on the water and marine biology. I said, wow, I could take the approach of population health and apply it to the lagoon. And I have gotten very active. I'm out cleaning up the lagoon. There are some incredible groups around here, up and down the lagoon, doing amazing work. And this county has also, in 2016, made a commitment to help clean up the lagoon and passed a 0.5-cent sales tax, which goes to a program called Save Our Indian River Lagoon. So I got involved in that as well and now sit on the Citizens Oversight Committee looking at how that 0.5-cent sales tax is spent. It is now in year 10 of that, and I've been on the committee for a year. So when you think about how you improve the health of a lagoon, it's really not that different from how do you improve the health of a community. How do you do population health and take that knowledge that I have and apply it to the lagoon? So think about it. If you look at my population health cycle, which begins with select, what did we select? We selected the lagoon. How do we fix the lagoon? It'd be just like selecting a community. How do we improve the health of a community? So what we have to do is we have to understand what are all the issues facing the lagoon. And we surveyed, or they surveyed, I should say, the lagoon and looked at what are the issues causing the poor water quality and algal blooms. What can we measure and what would we expect the requirements to be to achieve a level in which the lagoon would become healthy and begin to move in that direction. Once the county and this group put together the data on what the issues were, where they're located, whether it was muck, septic tanks, too much fresh water, loss of various habitats or things like that, and put that all together. And then they segmented it essentially like step 3 segment. What are the major drivers? What areas are they located in? And how do we address those? So they identified one of the major issues was muck. It was essentially one of the largest sources of nitrogen into this lagoon. They also then identified septic tanks. And it turns out, and I never knew this, but a typical septic tank only removes about 20 to 40% of the nitrogen. The rest of it flows down into the ground. And the issue we face here is that under the ground, but very close to it, is the water table. And that water table takes that water and those nutrients that have flowed through into it, and that comes out into the lagoon, pushes subsurface into the lagoon, as well as all the runoff from the streets and houses and roofs and buildings and their lawns and their fertilizer and whatever other chemicals they're putting down on this stuff end up in the lagoon. So you segmented it and said, okay, we got an issue with muck. We've got an issue with septic tanks. Can we connect them to sewer? Can we put in a high efficiency septic tank or advanced treatment units that essentially can take out maybe up to 80% of the nitrogen? Those are the kinds of things you then segmented out and said, okay, if we do these early, and then as we move forward, we can do others later that will help to improve the lagoon. The community then need to sell it. Obviously, you don't need to enroll the plants and animals, but you need to enroll the people. And the people spoke in 2016 and voted for this 0.5-cent sales tax, which, by the way, over the 10 years will raise about $580 million. The other advantage to the sales tax that was done then is the fact that it allowed the county to then draw down matching funds from the state and from the federal government to supplement that. And the other thing that occurs with this tax is that Cape Canaveral has a port. Port Canaveral is the number 1 or number 2 cruise port in the United States, in the world, I believe. And all of those tourists that come down here, whether they're coming to the port or Kennedy Space Center or the lagoon to enjoy it or to fish or to hang out, or the other tourist things that occur around here, also pay that sales tax when they buy stuff. So that has helped to offset some of that cost, and others from outside the community are obviously helping to support this effort.
Just tuning in? You're listening to PopHealth Week on Healthcare Now Radio with host Fred Goldstein, president of Accountable Health LLC. Stay tuned for the rest of the story.
Then you need to solve it. What do we do to fix the lagoon? And once you've implemented those, how do we score it? Are we seeing measurable progress? Is it working? After you've scored it, obviously the next step is stop, start, same. Do we stop things that don't work? we start new things that either are new because we've got new technologies or new ideas or new data, or because we've now achieved a certain level of some cleaning, and now we can look to do other things that required a slightly cleaner lagoon. And then we keep going with those services and things that we've implemented and programs to improve it. So let's talk about how we're fixing this thing. There are an incredible number of community-driven organizations doing work here, along with the half-cent sales tax. So we're seeing things like shoreline stabilization, replanting mangroves, clams, oyster gardens. And by the way, oysters are great filter feeders, as are clams, and oysters filter estimated about 30 gallons a day. And what else we're doing is we're removing the muck. We're pulling out this legacy muck so it doesn't flux up and cause this. At the same time, we're connecting the septic tanks to sewers. We're putting in new septic tanks. We're changing some of the flow, working with other organizations on some of these canals and pushing the water back to the west where it was originally going. And a lot of other efforts that then come on once you've done things like clams and putting in clams. There's a program now that's just amazing, trying to put 1 billion clams into the lagoon. And I think they just achieved 100 million in the last couple of weeks. And it's amazing to watch them fly these drones over and drop these clams over parts of the lagoon. But obviously you have to put clams or seagrass or oysters in areas where they can grow, where they can develop, where they can then create and spread out. So all of that is going on. We have the half-cent sales tax from the Brevard County Save Our Indian River Lagoon, and that's coming up on its 10th year and is actually up for renewal, and we'll see where that goes. The other thing to recognize with this whole project is the value of the lagoon is incredible. The 2025 Indian River Lagoon Economic Valuation Report, commissioned by the IRL NEP and conducted by the Balmoral Group, found incredible numbers. The total economic impact of the lagoon is estimated to be $28.3 billion, much of it driven by the aerospace industry, but also recreation and tourism, boat dealers and manufacturing, and natural resource management. For example, people don't think about the fact that having a waterway like this with the mangroves, etc., actually the mangroves provide protection from storms and flooding, and those wetlands provide protection as well. And you can also see the impact of the lagoon in that homes that are on or near the lagoon typically have an additional valuation of about $350,000. So that creates more property taxes, etc. All of these are important things to recognize. And so all of those things happen. We've got a space industry here. If you want people to move here as that space industry continues to grow, which is just incredible to watch and see these launches, is they have to have a place they want to come. Getting these engineers here, whether they're directly in the space industry or some of the support services, you want to come to a place that's nice. And so there's obviously a value to employment as well. And then there's a health value. And while there's not a lot of data on the lagoon, there are examples and information from the Poison Control Center that essentially can show, oh, we had an algal bloom here. Here's how many calls we got to the Poison Control Center because they were experiencing some sort of symptoms, or maybe they had to go see the doctor or the ER. Fortunately, things are getting a little better, so we're seeing less of that. When you then think about this from a population health perspective, I've tied my marine biology experience to my population health experience, and now look at these projects and say, just like you would look at an effort to improve the health of individuals living with diabetes, can we look at the health of the lagoon and determine that what we've done is making an impact? And what we're finding is we're beginning to see it. For the last couple of years, we have seen improvements in seagrass coverage throughout the lagoon. Some areas still don't have seagrass, but we're seeing it come back. We are seeing clearer water. We have estimates on how much nitrogen has been reduced and removed, as well as phosphorus. And all of these things are important because they are the start of getting this lagoon back. This was a world-class fishery for decades. Redfish, sea trout, snook, an incredible place. And that's what I recall when I would come down here in the 90s. I would come down to Mosquito Lagoon with my good buddy, and we would walk the flats, and the water was clear as could be. And you'd see seagrass in the areas with no seagrass, the potholes, and you would fish those and catch amazing fish. Some of the fishermen have talked about the fact that the fishing is coming back. We are beginning to see progress, but it's early. There's still a lot to do. And just like anything, if you want to change the health of a community, it happens over time. It takes a lot of effort. And this is taking a lot of effort. But as I said, we're also seeing fewer algal blooms, and those harmful algal blooms are also smaller. And I don't think enough focus has been done here, actually. We know what the economic value is of this lagoon. We know what the value is to fishing and boating and all the other activities. But what we haven't done here at the lagoon, which I'd love to be able to better understand, is what are the health impacts and what is the value to a healthy lagoon to, one, reduce these diseases or conditions that are caused by these harmful algal blooms or other toxins, say, in the lagoon, as well as what is the value to our lives to live in a blue space that is clean, that is a nice environment that you can get out on, relax, look at the water, perhaps go swimming, go hiking through some of these areas where they have parks in the mangroves, enjoy the Merritt Island National Wildlife Refuge, which is just an incredible place. You can see alligators, and that's what's amazing here. In the waters here, you can see an alligator and a dolphin and a manatee all in a similar place, which is just incredible. And you can essentially go out and go fishing or go boating or enjoy yourself on the water or sit at a local restaurant and enjoy that sunrise or sunset. It's really an amazing place. And as I've gotten to apply my population health work with the lagoon, it has been so enjoyable to me to be able to get involved with this. And the important thing is to understand also that there are data. There's data showing improvement, but many people don't know of the data, don't see the data. And one of the biggest issues we face, just like the issues in healthcare, we talk about health literacy. Here we can talk about lagoon literacy. And people's understanding and knowledge of the lagoon is very similar to the health literacy of people in the United States. It's just not very good. They don't understand what's happened. Many of the projects being done are underground or underwater, so people don't see them. In fact, I was talking to one of my neighbors who said, I've lived here for 16 years, and I haven't seen any muck removal. And they live on a canal, right on an opening to this area called Sykes Creek. And I said, well, do you know that just about a mile south of here, they did a muck removal right there? And phase 2 of that will be up almost to where this individual's house is. And they had no idea that this had happened or was going on. And so we have a huge burden, just like we do in population health, to try to explain and do a better job of explaining the issues and what works and the science. And as I've said numerous times, we talk about trying to improve health literacy, and it's great to try to do that, but that's a really heavy lift. What we need to do is take the information that we have and put it into a communications method that the individual themselves can understand. And we need to do the same thing about that with the lagoon. People will be concerned about muck. Why are you pulling that out? That's not the problem. The problem is a sewage leak. Well, yes, we have had sewage leaks in these communities. They are not that big. They are problematic. A sewage leak to me is similar to a never event in healthcare. It shouldn't happen. But they do, particularly when we get huge rains associated with a hurricane or something that would overload the sewer pipes. And part of the solution to that was actually smoke testing all the pipes to find where there were cracks or leaks and fix those so water couldn't flow into the pipes, causing too much to be in them for the system to handle it, which then caused the system to overflow. So there are a lot of things going on about the lagoon to fix it. It is just like population health, and it'll be amazing to see it. If you ever get a chance, come on down here. This area is really amazing. You can go into Orlando. It's a quick drive across, and you can also spend time at some amazing places like Kennedy Space Center, the Merritt Island National Wildlife Refuge, or head over to Cocoa Beach. You can go surfing or swimming or hit the port and get on one of those amazing cruises. There's just an incredible abundance of activities here in Brevard County that are amazing. I'm so fortunate to live here and so glad and happy that I do, and also so happy that I've been able to take my experience in healthcare, my love for marine biology, and put them together into an effort to help improve this lagoon. And if you're interested in following that, you can check out Explore the IRL. No E, XPLORE, the IRL for Indian River Lagoon on Facebook and YouTube. And I'm interviewing people and putting up videos and going out and helping to clean up and putting up videos on those as well. So if you get a chance, check out Explore the IRL and let me know what you think about this. Remember, you can take population health and apply it to a lot of different stuff. So thanks for listening, and I'll send it back to you, Greg.
And that's a wrap for today, folks. A big thank you to our global audience for tuning in. If Pop Health Week resonates with you, show us some love. Give us a thumbs up on your favorite podcast platform. Share it with your network and do subscribe so you never miss a future episode. Remember, we're live on Healthcare Now Radio every weekday at 5:30 a.m., 1:30 p.m., and 9:30 p.m. Eastern. That's 2:30 a.m., 10:30 a.m., and 6:30 p.m. Pacific. On behalf of Fred Goldstein, myself, and the crew at Healthcare Now Radio, stay safe, stay tuned, and we'll catch you next time.